Today we have Dr. Aditya Pradhan and he's practicing in Delhi NCR. We also have the presence of Dr. Sanjoy Kumar Surekha and he's practicing in Uttar Pradesh. We're going to be talking about kidney stone management as of now. Very welcome, sir. Very
Thank
welcome.
you.
The very first question goes to Dr. Aditya. That why do you think the cases of kidney stones are on high rise these days?
Many factors. So let's start with dietary habits where the fluid intake is a little low. Then there's a high intake of processed foods by salty foods. And the third is obesity.
Yes, sir.
All these lead up to a concentrated urine in which the salts
Right.
settle and then form a stone.
Sir, anything you would like to add to this?
There are few areas in India where these stone diseases are more common, like the hilly belt, like if you see, and dry state like Gujarat. So their water concentration is little higher than what actually you should have, the salt and other solute. So they tend to have a higher stone disease. That is one thing. And second thing, I think the stone disease incidence was still in the past also it was not low, but now with ultrasound, frequent availability of CT scan, the pickup rate is much higher.
Right.
So we are able to come across more patients because they can pick up early.
Right. Dr. Aditya, I would like to know from you what makes it very important for a stone patient to get it diagnosed as soon as possible, and what could be the complication if he is delaying the process?
A patient of stone will
Yeah.
come to you actually when he's symptomatic. So you have not many, like Dr. Sanjay was saying, that they had a stone, they don't know it is there, but
Yeah.
when an ultrasound is done for some reason of visiting a doctor, then you discover there's a stone. So those are silent stones.
Right.
But the other group is a person where a patient where the stone has gone and obstructed the system somewhere, that has produced severe pain, and that guy will not wait. He will go to a doctor immediately. Now, what is the need for early diagnosis? The need is that you know where, what kind of stones, dimensions you're dealing with, and what is the effect on the kidney.
Yes.
You treat a stone early, treat it properly, you are able to settle the symptom part of it as well as safeguard the kidneys. You don't treat it, or the patient delays his treatment, the pain disappears. Very often you will see patients with very large stone, patient who had no pain. He had no pain, he said, I don't want treatment, and then he lands up in the loss of kidney. So yes, treatment is important, treatment needs to be done correctly and to completion.
Anything Dr. Sanjay would like to add to this?
Yeah, in certain patients, the stone size may be very tiny, and the ultrasound is sometimes create lots of dilemma. Sometimes ultrasound will pick up 1 millimeter, 3 millimeter stones. Most of the time, those stones are not actually stones, and it creates a panic in the minds of patient. So, any stone size which is less than 4-5 millimeter on ultrasound that need to be confirmed by further evaluation if patient is asymptomatic to unnecessary avoiding treatment. So that part patient should understand. Lots of patients in my OPD visit often with a 1, 2, 3 millimeter stones on ultrasound. They are actually not harboring any stone.
All right. Okay. Dr. Pradhan would like you to recall one of your most challenging cases where the patient was delaying the process and landed up in a severe condition. And how did you tackle that patient?
This is not uncommon. What you are describing is in fact a fairly common situation when they land up in a hospital. So why have they come to us? Because he is in a problem. The simpler cases get managed by the GPs or his family physician. The problems are when the stone has become a troublesome matter in terms of effect on the kidney. So I can't just specifically point out one case. But yes, we have had patients with large stone, multiple stones, and we have had to do fairly complex surgeries to get rid of them. Many patients like that. I can't say one spectacular case like you would like me to point out.
One question from both of you. What you both think is going to be the next big breakthrough when it comes to the kidney stone domain?
The big breakthrough will be probably understanding what is formed a stone. We are not clear about all the factors. We are aware of some of them. And then if you have a specific problem, you can give them a solution. Right now we are doing what is blunderbuss therapy. We are trying to make urine more amenable, the environment more available so that it doesn't form a stone. We don't know every person's problem. Some things are genetic. Once we have that, then we are able to say, okay, this is your problem and this is the treatment. I think that's the holy grail of stone treatment.
Dr. Sanjoy would like to.
Yeah, as sir said that prevention strategy is not very clear. Even a patient is forming multiple time stones, even we do all kind of test, all battery of test, only 10 to 15% patients we can find out a specific cause. Otherwise 80 to 90% patients, those who are adult. In children sometimes this detection rate is little higher, maybe 30%, but in adult, even in a multiple recurrent stone former, we are not able to answer them why this stone is forming. We give them all the behavioral, lifestyle, dietary modification. Still, they keep on producing stones. So this is a real challenge, and I don't know how we'll get an answer, but definitely science will find an answer for it.
Well, Dr. Pradhan, any take-home message for our viewers?
My only take home is don't neglect a stone. If you have been diagnosed with a stone, yes, there are some medicines which are given and they help in the small stones which may pass out in a couple of weeks. Do not equate the absence of symptoms that my stone has gone now. It's not like that. Sometimes a stone is stuck in the ureter. It has created pain initially, pain has gone, and then after that you discovered actually the stone is still stuck there and the patient has lost his kidney. So better you follow your doctor's advice. Ensure that you have completed whatever treatment you have been advised and you document, yes, now I'm stone free. I think that end point you should be very clear.
Anything from you, sir?
Yeah, for all the viewer who is listening to us, they should understand 2-3 lifestyle modification that can by and large may reduce the stone formation rate, which include one is good lifestyle, including obesity management. Obesity is I think, is the biggest problem in all patients who might we treat for stone disease, and treating them doing surgery is very difficult for us. So obesity management is important, and adequate water intake. Most of the people now is in the office working like us, we are operating like for a whole day. Sometimes we even neglect adequate water intake. So water intake should be in multiple episodes. It's not like you take a 2 liters of water in the morning and again you are taking in the night. So keep on taking water in a regular break, and the amount of water should be such that your urine amount should be more than 2 to 2.5 liters. So somebody can ask you how much water I should take, 5 liters, 6 liters. So it may varies with people to people. Somebody who is working in field, having a lots of sweat, he may require 4 liters. Otherwise, you are sitting in an office comfortable, 2 liters may be adequate. So amount of urine is more important, and you should not avoid calcium in most of the stones. You should have adequate calcium. So calcium and vitamin D deficiency is one of the major cause of stone formation in our region, we feel. So adequate meal product should be taken, and these 2-3 messages. And I just want to put a disclaimer at the end that whatever we discuss, we don't have any financial conflict of interest. It was just for the awareness of the public. Thank you.
Yeah,
Thank you so much,
Thank you very
gentlemen.
much.
It was very nice having both of you on board. Thank you.